Botox for hyperhidrosis. Hyperhidrosis is the medical term for excess sweating, and the majority of people get this in the axilla, which is the medical term for armpits. If you are somebody who maybe does lots of presentations, gets nervous and finds that they are embarrassed by having sweat marks on your shirt, this might be the perfect treatment for you. Some of the deodorants on the market which are made to help with excess sweating can actually make the skin very sore. So this is where Botox can actually come in very handy. It's not going to give you wrinkle-free armpits. It works in a very different way. It actually affects the sweat glands in the armpit and reduces the amount of sweat that they produce. It's actually injected very superficially under the surface of the skin rather than into the muscle, which is what we do when we inject Botox in the face. The procedure is really quick and relatively painless, using the tiny invisible needle that I use for this procedure. I grid the armpit into squares and then will insert the small needle subcutaneously, which is just under the skin, to create very small amounts of the product in a uniform distribution in the armpit. It is painless, you do not need any local anaesthetic, and the procedure maybe takes 15 to 20 minutes, after which you can be on your way. One thing to note, however, if you have hair in the axilla, this does need to be shaved prior to having the procedure done. The effect of the sweating is reduced. It does take about 4 to 5 weeks before you start to notice the effect, but then the results can last for up to 6 months, so it's a really good treatment. Some of my patients only choose to have it in the summer months, but I do have many patients who will have it all year round, as once they've tried this, it actually changes their life dramatically.